Hello, and welcome to today's webinar titled Harvard and Healthy People 2030, Assessing Health and Well-Being. My name is David Rogers, and I am the Director of Alumni Affairs at the Harvard T.H. Chan School of Public Health. The program being put on today began as a concept brought to us several months ago by our Washington, D.C. Harvard Chan School alumni president and 2009 graduate, Jennifer Bishop. Jen serves as a senior advisor in health promotion and communication in the Office for Health and Human Services, Office of Disease Prevention and Health Promotion. Jen shared with our office how connected and relevant the Healthy People 2030 initiative is to the Harvard Chan School community, with both Harvard Chan alumni and faculty currently working on various aspects of the initiative. The Office for Alumni Affairs is always looking to support programming that highlights the important work of our alumni and faculty, so we are happy to bring this program to you today. We invite you to submit questions to our speakers, and you can do that by adding your questions to the Q&A box. If you are directing your question to a particular person, you can specify who that is, and I'll ask that person. So now I'd like to introduce the speakers on today's program. Dr. Howard Koh is the Harvey Feinberg Professor of the Practice of Public Health Leadership at the Harvard Chan School of Public Health and the Harvard Kennedy School. Dr. Koh is also the faculty co-chair of the Harvard Advanced Leadership Initiative. Ms. Emmeline Ochiai is Senior Advisor in the Office of Disease Prevention and Health Promotion and also serves as a Senior Advisor to the White House Initiative on Asian Americans, Native Americans, and Pacific Islanders, where she is serving as a designated federal office for the President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders. She is a 1997 graduate of the Harvard Chan School with an MPH in a concentration of law and public health. Commander David Huang is the chief of the Health Promotion Statistics Branch at the Centers for Disease Control and Prevention's National Center for Health Statistics. He is also a Harvard Chan alum, graduated in 2008 with a master's in public health and quantitative methods. Dr. Nico Pronk is president of the Health Partners Institute and chief science officer at Health Partners Incorporated and holds a faculty appointment as adjunct professor of social and behavioral sciences here at the Harvard Chan School of Public Health. Dr. Pronk also served as the co-chair of the Secretary's Advisory Committee on National Health Promotion and Disease Prevention Objectives for 2030. Thank you all very much for being here with us. There's one person I did not introduce because he will introduce himself, and that is Rear Admiral Paul Reed. I will turn that over to Rear Admiral Reed, who will kick off today's program. Paul?
Thank you, David. I assume you could hear me okay?
Yes.
Great, thank you. And thank you to everyone for joining today's Harvard T.H. Chan School of Public Health, the Washington, D.C. Alumni Chapters webinar focused on the U.S. Department of Health and Human Services Healthy People Initiative. I do apologize for my voice. It's been coming and going for weeks now, and of course, today it failed me a little bit. I'll try to get through this without any troubles. As David alluded to, I'm Rear Paul Reed with the U.S. Public Health Service and Director of the Office of Disease Prevention and Health Promotion within the Office of the Assistant Secretary for Health here in the Department of Health and Human Services. First of all, thank you for having me and my colleagues join you all for this discussion. Today's webinar is particularly special because it is meant to highlight the important contributions that the Harvard T.H. Chan School of Public Health has made in helping to shape and implement healthy people over the years. Not only have Harvard Chan faculty like Dr. Koh and Dr. Pronk, who joined us today, played instrumental roles in developing and supporting implementation of healthy people, so have many of the school's alumni. In fact, we are very proud of the work of Emmeline Ochiai and Dr. David Huang in developing the current iteration of the initiative, Healthy People 2030, and are happy to showcase the product of their efforts in this afternoon's discussion. So Healthy People released its first set of national objectives in 1980 and is the longest running disease prevention and health promotion initiative within the federal government. It is no exaggeration to say that it is a cornerstone of the U.S. Department of Health and Human Services work to improve our nation's health. With each decade, Healthy People provides specific science-based objectives with targets for improvement that represent the key health priorities for the nation. Healthy People objectives are meant to help individuals, organizations, and communities address pressing public health issues, identify areas of focus and populations with the greatest need, and shed light on what is working and what is not. In previous decades, over the past 40 years, Healthy People has brought national attention to issues like the social determinants of health, health equity, health disparities, and health literacy. Healthy People 2030 is our 5th iteration of the initiative and continues to focus on these imperatives as part of the overarching effort to ensure that everyone has equitable opportunities to achieve health and well-being. And Healthy People 2030 overtly acknowledges that health is more than the absence of disease. And health is, most importantly, derived from the conditions of our daily lives, not simply from the doctor's office. As a physician and a public health professional myself, I've come to understand this as a simple but long neglected and key concept to better health outcomes. Health results from the choices that people are able to make in light of their social and environmental circumstances, and therefore the options that they have available to them. Extensive evidence points to ways that predisposing risk factors, personal choices, and environmental factors profoundly influence health. And this is reflected in Healthy People 2030's social determinants of health framework, which is used across the government and is obvious in the initiative's first set of social determinants of health objectives with 10-year targets. Our SDOH objectives highlight the importance of upstream factors that are necessary to reduce health disparities and improve upon and maintain healthy individuals and communities. In Healthy People 2030, we also have a new and expanded focus on the broader implication of well-being. This emphasis on well-being reflects a shared vision between our work and that of the Harvard Chan School's Frontier Initiative, which seeks to discover the link between our health and how we feel, interact, and live. In Healthy People 2030, we describe well-being as how people think, feel, and function, and how they evaluate their lives as a whole. And we believe that the concept of well-being is so critical and influential to the nation's health that as an extension of Healthy People 2030, we established overall health and well-being measures to help us monitor Healthy People 2030's vision of a society in which all people can achieve their full potential for health and well-being across the lifespan. During today's program, you will hear more about the importance of Healthy People 2030, its development, the role of data in developing and monitoring the initiative, and how well-being is integrated into our current efforts. And the folks you'll hear from are all members of the Harvard Chan community, except yours truly, and have each played a critical role in Healthy People 2030's development. And given the deep engagement of the Harvard community in helping to create Healthy People 2030, we hope that today's session will give you additional insight into our program, so you can join me, our team, and your colleagues in using Healthy People in our common goal of improving our nation's health. So thank you very much. I appreciate the time to introduce this session. It promises to be very rewarding. I will now turn things over to Dr. Howard Koh, former Assistant Secretary for Health and actually a former boss of mine in a prior life, who will discuss the importance of healthy people from his perspective. Dr. Koh.
Thank you so much, Admiral, and welcome everybody. It's so wonderful to join this very, very exciting webinar. And I just want to make some personal remarks for a couple of minutes before we get into the program. I've been thinking that this webinar brings together all my favorite organizations, my favorite programs, my favorite topics, and my favorite people all in 1 hour. And so let me start by thanking the Harvard Chan School of Public Health, and particularly my wonderful colleague, David Rogers. He brings such leadership to convening this wonderful network of alumni and all the people who care so much about our school and our community and public health at large. David, many thanks to you and the team. And I'm now a faculty member here for the second time, but I left in 2009 to join HHS, the Department of Health and Human Services, as Assistant Secretary, as many of you may know. And there I had the incredible pleasure of working with the Office of Disease Prevention and Health Promotion, with Dr. Reed's team, particularly with Carter Blakey and Emmeline Ochiai and David Huang, and working on healthy people as the ASH, as they called me, the Assistant Secretary for Health, was one of the absolute highlights of my run for reasons I'll get into in just a second. So it's great to be reunited with you all on this. Since coming back to Harvard, I've been involved in many efforts related to social determinants of health. And one is to bring the worlds of private business and public health closer together. So it's great to have my colleague, Dr. Nico Pronk, here talking about dimensions of private business and public health in this webinar. And then we've already heard mention Jen Bishop, who the world is very small, was a teaching assistant for me when she was a doctoral student at Harvard many years ago. And without Jen, that course never would have run well. With Jen, it ran beautifully. And I'm so proud that she got her degree from our school and then went to join HHS and the wonderful team in the Office of the Assistant Secretary for Health. So those are all the personal themes that make me very excited about today. And then with respect to healthy people, you've heard from Dr. Reed the very distinguished history of this initiative that's now going into its 5th iteration over many decades. This is a really tough time in public health right now, and you all have lived the devastation of COVID on public health and all the social determinants. And indeed, healthy people with each iteration addresses the challenges of the moment. So COVID is that global challenge right now. And in a time of incredible division in our country and around the world, Healthy People has time and again been the roadmap and compass for all of us. It aligns us, it unifies us, it brings together the best scientists and the best public health professionals. It relies on data and evidence. It sets goals and tracks them objectively. And so time and again, in dark moments, in my view, Healthy People can give us a vision for the future and hope for the future and make us think about how to make the health of the country and the world even stronger going forward. So as you will hear today, there's a lot more emphasis on this version of Healthy People 2030 on issues like health literacy. That's a topic that's very important in the time of COVID, where everybody is starving for current information they can understand and use to help themselves and their families and their communities. There's great emphasis on health equity, which is such a key theme. And if I can say, as an Asian American and the proud son of an immigrant family, these themes have been ones I've thought about my whole life. I am delighted that Healthy People 2030 is taking a broader view on the definitions of health. We know that the WHO defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And in that regard, I've had the great pleasure since coming back to Harvard in 2014 to work with a wonderful colleague, Dr. Tyler Vanderweel, who I think is on this webinar right now, because he's leading an effort that I'm helping to support on talking about well-being and flourishing, not merely absence of disease. And that theme is certainly running through Healthy People 2030. And then, of course, there's so many opportunities now with the new Biden administration tackling so many critical issues, bringing together resources through the American Rescue Plan and hopefully more under the infrastructure bills under consideration. So all these themes come together to make Healthy People come alive going forward. So thank you so much for your support. I look forward to hearing from our experts here and then making some closing comments. Thank you so much.
Great. Thank you so much, Howard, for that wonderful introduction. I'm Emmeline Ochiai. Next slide, please. And I'm here to provide you with an overview of Healthy People. Healthy People provides a comprehensive set of science-driven, measurable objectives with 10-year targets and assesses progress over the decade. It underpins HHS's priorities, strategic initiatives, and it provides a framework for prevention, wellness programs, and for a diverse array of federal and non-federal users. The Healthy People initiative is grounded in the notion that establishing national health goals and monitoring them over time can motivate action. And Healthy People is used by communities, states, county, local, and local health officials, community health advocates, non-governmental organizations, members of clinical and public health communities, researchers and academia, foundations, and federal government. Additionally, it's increasingly employed by businesses and sectors who seek to improve the health of their populations, address social determinants of health, and advance equity. You may be wondering what are some specific ways that users harness the power of Healthy People 2030. Healthy People is used as a data tool for measuring program performance, a framework for program planning and development, metrics for setting goals and building agendas, assessing progress over time. It's also a tool for teaching public health courses, a set of national benchmarks used to compare state and local data, and a platform around which to forge and leverage partnerships. Each decade since its inception, Healthy People has evolved to reflect our most current science and knowledge And as a result, each decade, healthy people's efforts have moved further upstream. For example, Healthy People 1990s overarching goals focus on decreasing mortality and increasing independence among older adults. Healthy People 2010's overarching goals were to increase quality of life and eliminate health disparities. And Healthy People 2030's overarching goals are to attain healthy, thriving lives and well-being, free of preventable disease, disability, injury, and premature death, eliminate health disparities, achieve health equity, and attain health literacy to improve the health and well-being for all, create social, physical, and economic environments that promote attaining full potential for health and well-being, engage leadership, constituents, and public across multiple sectors to take action and design policies that improve the health and well-being of all. Healthy People has been developed with important partners, including the Secretary's Advisory Committee on National Health Promotion and Disease Prevention Objectives for 2030, federal Healthy People subject matter experts, and input from the public. These are the 2030 vision and mission. The vision highlights where HHS wants to be as a nation by the year 2030. The mission of Healthy People describes what Healthy People 2030 and we collectively need to do to attain this vision. I'd like to draw your attention to these two Healthy People 2030 overarching goals. Healthy People is striving not only to eliminate health disparities, but also to achieve health equity. HP 2030, or how we refer to Healthy People 2030, defines health equity as the attainment of the highest level of health for all people. Achieving health equity requires valuing everyone equally with focused and ongoing societal efforts to address avoidable inequalities, historical and contemporary injustices, and the elimination of health and healthcare disparities. Health disparity is defined as a particular type of difference that is closely linked with social, economic, and/or environmental disadvantage. Through Healthy People 2030, we recognize that health disparities adversely affect groups of people who have systemically experienced greater obstacles to health based on their racial or ethnic group, religion, socioeconomic status, gender, age, mental health, cognitive, sensory, or physical disability, sexual orientation or gender identity, geographic location, or other characteristics historically linked to discrimination or exclusion. Social determinants of health are the conditions in the environment in which people are born, live, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risks. The social determinants of health also contribute to wide health disparities and inequities. In addition to Healthy People 2030, including the improvements to social determinants of health as one of its overarching goals, Healthy People 2030 includes a separate SDOH topic with 6 specific measurable objectives addressing poverty, employment, housing, incarceration, and education. Healthy People 2030 includes this SDOH model to conceptualize the 5 key domains that impact health. Each of these 5 domains reflects a number of key issues that make up the underlying factors in the arena of social determinants of health. Examples of SDOH include safe housing, transportation, and neighborhoods, racism, discrimination, and violence. Language and literacy skills are another social determinant of health, and Healthy People 2030 ushers in an expanded definition of health literacy. The expanded definition includes not only personal health literacy, but also reflects the systemic impact of organizational health literacy. Healthy People 2030 is composed of several unique elements that complement one another and are designed to collectively contribute to its vision of a society in which all people can achieve their full potential for health and well-being across the lifespan. These include the overall health and well-being measures, the leading health indicators, and the core developmental and research objectives. The overall health and well-being measures are broad global outcome measures intended to assess Healthy People 2030's vision. The overall health and well-being measures are being used to summarize and evaluate progress towards achieving Healthy People 2030's goals. Healthy People 2030 also includes, within those overall health and well-being measures, 8 specific OHMs, and they're organized into 3 tiers: well-being, health, healthy life expectancy, and summary mortality and health. With the overall health and well-being measures, 2030 introduces the first nationally representative measure of well-being, something that our colleague Nico Pronk will address later during this panel. The leading health indicators are a small subset of high priority Healthy People 2030 objectives selected to drive action towards improving health and well-being. The LHIs communicate high priority issues to the public. They're an entry point for organizations and individuals, and the actions that can be taken to address them are outlined by the objectives underlying the LHIs. The cornerstone of Healthy People 2030 are specific measurable objectives. Healthy People 2030 includes 355 core objectives, 114 developmental objectives, and 40 research objectives. Core objectives are measurable, they're of high national importance, and they address health equity and or health disparities, have a baseline data that is no older than 2015, have an assurance of at least 2 data points throughout the decade, and then have an improved data source. Developmental objectives represent high priority issues that do not have reliable data, but for which evidence-based interventions have been identified. And research objectives may or may not meet core objective requirements and may not yet have the evidence-based interventions developed. However, they represent specific significant opportunities for progress in areas with limited research, a high degree of health or economic burden, or evidence of substantial disparities between populations. Healthy People also comes with a suite of user-centered interactive tools for action. Accessing these tools begins with visiting the Healthy People 2030 website. Here you can see the specific items that are available with the drop-down menus. And I'd like to show you an example of one of Healthy People 2030's core objectives, the number of diabetes cases diagnosed yearly. For each core objective, you can access the current baseline data, the desired target to be achieved by the end of the decade, the data methodology used, and the evidence-based resources. By clicking on the evidence-based resources in the left-hand navigation, you can access the evidence-based resources recommended by HHS subject matter experts for action and implementation. Another unique tool available is the ability to create curated custom lists of objectives that you can share with others. By clicking on the Add to Custom List button seen in the lower left-hand corner, you can create your own custom list. And once you create a custom list of objectives, you will have access to a unique URL you can share with your colleagues and others for action. It is now my pleasure to introduce my colleague, David Huang, from the National Center for Health Statistics. David?
Great. Thanks so much, Emmeline, and thank you to the Harvard T.H. Chan School for the opportunity to speak at this webinar. I'm David Huang, and I lead the branch at the CDC's National Center for Health Statistics that serves as the data and statistical advisor to the initiative. And as such, I will cover several data-related topics as they relate to healthy people. First, I'll talk a little bit about the data, including some of the data and data source requirements we have developed for Healthy People 2030. Now, Emmeline actually went over kind of a Cliff Notes version. I'm going to expand a little bit on the objective selection criteria that we used for core objectives. These criteria were established to evaluate proposed objectives for inclusion into the core set. And you can see the 5 criteria here. The first one is that the objective must have baseline data no older than 2015, and they must be from an approved data source. Objectives must have at least 2 follow-up data points after the baseline, which means they must have at least 3 total data points for the decade. Then we have a criterion on national importance, and you can see the components of that listed here. Next are the evidence-based and effective interventions to achieve the objective, which Emmeline also alluded to. And then finally, the proposal must include an assessment of health disparities and health equity. Implementing the objective criteria on the previous slide, as well as some of the data source criteria shown here, contributed substantially to a more statistically rigorous set of objectives for 2030. Nationally representative, publicly available data with known population coverage, response rates, and complete documentation ensures transparency and allows for replication of findings. So these were all critical data source criteria that were developed and applied this decade. 2030 has also made substantial improvements in the area of timeliness. As has been alluded to with the criteria, the frequency of data is certainly very important and was one of the criteria for the objectives themselves. But beyond this, NCHS has made numerous improvements to our IT systems that have allowed for more frequent updates to the Healthy People website. For Healthy People 2020, data were actually typically updated about 2 to 3 times per year. For Healthy People 2030, data updates can be made on an as-needed basis. Now I'll move on to some material on targets. There are many federal indicator projects, but the inclusion of quantifiable targets is a unique feature that distinguishes Healthy People from other federal prevention initiatives. Targets communicate policy expectations as they can be seen as a benchmark for what is to come over the next 10 years. And targets also offer a marker for assessing progress over the decade for individual objectives, for groups of objectives, and for the initiative as a whole. The current decade, Healthy People 2030, aims for greater transparency and a more systematic approach to target setting than in past decades. And this will allow for state, local, and other partners to be able to use the same methods to set targets. And it also ensured that the Healthy People work groups considered data-driven tools to set targets. General requirements for 2030 targets are that they should be challenging yet achievable, and that they should be a statistically significant improvement from the baseline, the primary exception to this being the target to maintain the baseline. And as far as the process, Healthy People 2030 targets are set by topic area work groups, which are comprised mostly of federal subject matter experts, and then are approved by the Federal Interagency Work Group, which is the steering committee. This setting process ensured not only transparency in the way that targets were set, but also consistency in the application of the guidance that was set forth. NCHS, in its role as statistical advisor to the initiative, provided methodological guidance and also tools to help guide the process in partnership with ODPHP. For the first time in Healthy People history, a flowchart was developed to help topic area work groups use an explicit and consistent process to select targets. And I'll actually go over this flowchart briefly on the next slide. But before I do that, I wanted to show you the 6 target setting methods in the bullets shown here. And then also mention that in addition, the methods, detail, and justifications are all included on the Healthy People 2030 website for each of the core objectives. So here we have the flowchart that I mentioned previously. And again, this is what the Healthy People topic area subject matter experts use to arrive at a recommended target setting method. The decision points here lead the user to a recommended target setting method, with the methods shown in these green circles here, having accompanying target setting tools that NCHS developed to further assist in the selection of a target among a list of potential targets. Note at the bottom that subject matter experts could still select a method that was not recommended. However, this was rare and required additional justification. I'm just going to go through a quick example of one of the targets using trend projection. And you can see with this green circle that this was one of the target setting methods that had an accompanying tool that NCHS developed. Specifically, NCHS developed a trend analysis tool that work groups could use to enter historical data. The tool would then use these data to fit a trend line using weighted least squares. And then the tool came up with up to 5 candidate target values from different prediction intervals for the desired target years, where the target year was about 10 years from the baseline year. When using the trend tool, NCHS did ask the work groups to also consider evidence to support any of the target values and also to review the data to evaluate if there was a change in trend. In some cases, the tool would not produce a viable target value, and in those cases, other target setting methods were proposed. In this example that I'm highlighting here, which is to reduce the rate of infant deaths or infant mortality more commonly, the baseline is 5.8 infant deaths per 1,000 live births. And the target, which again was produced using this trend analysis tool, was 5.0 infant deaths. And this was arrived at using a projection of the historical data using a 75% prediction interval. Now I'll move to just a quick screenshot from the 2030 site. I know Emmeline also highlighted this, but I wanted to just point out some data-related elements that you'll see for individual objectives. This is what we call our data snippet. It basically provides an at-a-glance view of an individual objective. You can see at the top in the blue bar is an objective status. In this case, we only have baseline data, but this will actually be updated over the course of the decade as new data come in. We also have the baseline statement, the target and target setting method, a link to the data source where you can find out more information about that particular data source, and then more information about how the data are measured. And I'll note that that last link actually includes some information about the target, including the target setting method, as well as the justification. The final topic that I'll briefly discuss is health disparities. Some of you may be familiar with the 1985 HHS report of the Secretary's Task Force on Black and Minority Health, also known as the Heckler Report. This was released by then HHS Secretary Margaret Heckler, and this report focused on healthcare access by minority groups, as well as on the 6 causes of death that accounted for more than 80% of mortality among racial and ethnic minorities. These findings serve to mobilize some of the disparities-related work and infrastructure still present in HHS today, including the inclusion of a disparities-related overarching goal for Healthy People 2000 when it was released in 1990. You can see that since then, this goal related to disparities has evolved over the past 4 decades. And you can see that the current goal for 2030 is to eliminate health disparities, achieve health equity, and to attain health literacy to improve the health and well-being for all. We launched Healthy People 2030 last year without template data or population data, but we are now in the process of adding these data using a standard 2030 data template for population-based objectives. Data will be shown when the data source collects this information and applicable presentation criteria are met. And there will be limited ability for work groups to request customization of this template for individual objectives. Notably, for the topic of health disparities, these are the standard sets of population groups for which disparities will be assessed in Healthy People 2030. In addition, some objectives have more of a disparities focus in and of themselves and apart from the population template by focusing on a higher risk population group, such as age groups or LGBT populations. Since our Healthy People 2030 disparities tool isn't yet available, I wanted to briefly highlight the Healthy People 2020 disparities tool. This chart shows disparities in new cases of diabetes by race and ethnicity over time. And note that we have actually closed out data tracking for Healthy People 2020 and have shifted data updates for 2030. So some of the data shown here aren't the latest available data. There is a text box at the top that's kind of covering up part of the chart showing the data. But you can see on the right the range of values for 2014 to 2016, with the group with the most favorable rate shown in blue font, that's the white non-Hispanic group, and then the group with the least favorable rate in red font. This is American Indian or Alaska Native for this particular objective and data year. The summary text box that appears when you hover over a data year provides a summary of disparities for that particular year, and then you can also see some footnotes below the chart. By clicking on a specific year, users can get additional data for that year, and that's what's shown on the next slide. With a chart at the top, in this case, racial ethnic data for 2013 to 15 for the same objective. And then below the chart, we have a summary disparities data table, as well as summary bullets describing measures of disparity. I'll close my remarks by saying that the Healthy People team is currently working on a health disparities tool for 2030, and we'll have more to share in the coming months. That concludes my remarks, so I will now pass the baton to Dr. Nico Pronk to discuss well-being. Nico?
Great, thank you very much. And thank you to the organizers for inviting me today to join this webinar. It's a pleasure, as well as recognizing that it's been really an honor and a privilege to serve as the co-chair for the Advisory Committee for Healthy People 2030. It's actually been for me quite a bit of a humbling experience in the sense that it showed how small of a component the advisory committee actually is when you think about the entire enterprise that makes up Healthy People 2030. And I think you've already seen in this presentation today that there is so much more than just advice and guidance to make this a program and the program that it is. The website is incredibly rich, and you just saw a couple of examples of what it can do already. So I look forward to seeing it develop and evolve over the coming decade. Starting right out with the first slide here. Based on community feedback and public input, there was really a need to create a definition for health and well-being as we went through the process of introducing that idea into Healthy People 2030. The definition that we landed on, how people think, feel, and function at a personal and social level, and how they evaluate their lives as a whole, really was a request from public input directly. As the health and well-being term was included in just about every component of the framework that Healthy People came up with for 2030, the feedback that we got very early on in that process was basically, well, when you talk about well-being, what really do you mean? So the advisory committee stepped back, created a brief that really explains the thinking behind the movement from just health alone to including well-being and integrating it into the program, so that feedback was really addressed head on and was linked and anchored, if you will, to a definition that reflects health and well-being in the way that the advisory committee really thought about it. The definition of health, definitions of health are certainly available throughout, as well as there are examples of well-being. But what is unique about the Healthy People 2030 approach is that this definition really combines health and well-being and considers it in a single term. So this is kind of a new way of thinking, if you will, that reflects the idea that health and well-being are really mutually reinforced. And at the same time, we want to make sure that there's also an actionable component to this idea of defining health and well-being in a bit of a transformational way. And so the way you can think of it is that in a nested way, the definition covers from the level of the country, the nation as a whole. It could be applied at the state level. It could be applied at the tribal level, municipalities, communities, as well as organizations. And so the idea of moving forward with an initiative that really needs to think multi-sectoral and across different stakeholders and engage deeply with different stakeholders in order to meet its objectives. This definition really felt like one that could be applied at these multiple levels. The measurement approach was also considered. And I think as you go into the measurement of and the target setting, as we just heard, for Healthy People 2030, there is a lot of recognition of determinants of health in different ways. But one measure that was proposed and is now becoming a reality is the introduction of life satisfaction as a key indicator of how people evaluate their lives. There are, of course, multiple ways of going about this from a measurement perspective, but that one is a single measure, a single question that doesn't take up a whole lot of real estate on different surveys, and I think is a good one to pursue. So the term health and well-being implies really this notion of separate but related states that influence each other in a mutual reinforcing relationship. Health impacts on well-being and vice versa, well-being impacts on health. But yet they are, even though they travel together, they're not quite identical. We also look at the assurance of equitable conditions for health and well-being as a key goal of good government, effective philanthropy, citizenship, self-determination. And these kinds of concepts are really reflected in the definition as well. And then together, equitable health and well-being describes factors that are deeply rooted in personal as well as societal values. So this is, in a sense, a crosswalk, an opportunity to bridge from personal objectives to deeper determinants of health, social justice, safety, prosperity, issues of civic engagement and environmental integrity are reflected in this approach as well. And yet at the same time, even though many of these are causes of inequity, causes of and reflections of less than optimal health, the idea of adding well-being to health also reflected our objective in our interest to be more positive, to look at an asset rather than a deficit. Oftentimes, health is measured by deficits rather than looking at the more positive side of assets. And so that's really how the health and well-being definition came about, and also recognizing at the end of the day that health and well-being is both a determinant as well as an outcome of the interest that the Healthy People 2030 initiative has. So, reflecting on the role of health and well-being in the Healthy People 2030 initiative overall, it is actually woven in throughout the entire framework. Almost every component of the framework has the term health and well-being reflected in it. Promoting health and well-being takes place across a different set of environments: the physical environment, the social environment, the economic environment. And all of these environments need to be cultivated into a healthier overall environment in which people live, really find themselves at different times of their lives. It also involves various stakeholders as well as multiple sectors. So there is a shared responsibility across those sectors in order to really achieve all the objectives that are represented in the initiative as a whole. It cannot be limited to a single sector, the health or healthcare sectors alone. We have to reach out across multiple sectors and do this work together as a society. At the same time, there is this focus, as Emmeline has talked about, on health disparities and health equity and health literacy, because we know there are major gaps there, and those gaps need to be closed in order to see an equitable improvement across all the targets that have been set. And finally, physical, mental, and social dimensions of health and well-being need to come together, and there needs to be a collaboration among the public health and clinical care delivery systems in order to do that well. That sort of allows us to focus in on improving health and well-being across the lifespan as the key mission and vision reflected here in this framework. However, in order to make sure and ensure that we can actually improve, and so that there is improvement represented in the metrics that are flowing throughout the course of the decade, we have to have actionable data, which really is the heart of the entire Healthy People 2030 program to begin with. That it's not just data being reported on a regular basis, but there is an aspect of that data that allows us to take action and iteratively move forward. That sort of links us into the need for evidence-based interventions. Without some sort of a portfolio of programs and services and interventions, it is unlikely that this kind of progress will be made. But really, at the end of the day, we don't live in a society with limitless resources. So the resources that are available need to be strategically applied in order to do this work and do it well. So this framework here represents, I think, a very, very strong approach to identifying the process as well as the outcomes associated with the overarching work that is going on in Healthy People 2030. And with that, I will actually limit my comments to this set and hand off to Howard for discussion and conversation.
Thank you, Nico. I'll actually take that. Thank you all so much for sharing this incredible work you are all doing on this important public health initiative. We do have some time for some questions from the audience, and a few have come in the Q&A box. And first, I'd like to go back to the beginning We have a question from a former student of Dr. Ko's, and this might be for Dr. Ko or the Rear Admiral. And the question is, how is the HP 2030 and beyond considering the intersection of climate change and social determinants of health? This person is specifically interested in considerations around green space and the built environment. Who wants to take that?
So the specifics, I'm going to defer to my colleagues here, but let me just say this is a historic time for our country because we have a president that's absolutely prioritized climate change and health equity explicitly. As one example, there's a new coordinating office on climate change and health equity that's being established at Health and Human Services. So that's a huge step forward. And then you know that every day you turn on the TV and you're seeing all these terrible weather events that are definitely exacerbated by the climate change crisis that we're having indeed around the world. In light of that, again, the administration led by the president has, for example, committed to having 50% of all autos be electric vehicles by 2030. And that raises all kinds of issues about resources and impacts, and particularly health equity impacts. If I can just say, a couple of days ago, we had a webinar at our school sponsored by Robert Wood Johnson Foundation about electric vehicles and their future and how it impacts health and equity. And all these themes got brought up about, how are we going to develop batteries through a supply chain that's being stressed by COVID? How are we going to get charging stations available to everybody, not just those with private homes and who have the resources? How can we bring the costs of electric vehicles down, and so that's not available just to high income people? So all those themes directly relate to the healthy people theme. So I'm hoping that once we hear about the infrastructure bills and how much money is actually going to come out, that's all under great debate before Congress right now, that there'll be tremendous resources to apply to this very important area.
Thank you. Oh, go ahead.
Maybe I can just join Howard in addressing this question. I think one of the unique features of Healthy People 2030 was that we moved from a specific set of objectives to objectives that were core objectives, and then the developmental ones and the research ones. And obviously, from a measurement perspective, which is sort of the heart of the Healthy People initiative, you can't jump in with new measures without sort of making sure that they actually do reflect what is intended to be measured. And so some of the indicators that maybe relate to climate change may need some more work before they're ready for a prime time in Healthy People. And so that the developmental and the research objective sets allow us to basically work on that throughout the course of the decade. And it's certainly a hope that over the course of the coming years, there will be an additional set of metrics that will come through that process that will eventually become core objectives for the Healthy People initiative. And so that background and context that Howard just outlined hopefully will move itself slowly but surely into the set of metrics and targets related to Healthy People.
I can also share that dovetailing off of Nico's comments is that we annually assess and provide opportunities for research and developmental objectives to be considered as core if they meet the core requirements, and then they are vetted by the Federal Interagency Work Group Steering Committee. And I'd also like to confirm that, as Dr. Ko mentioned, we did, the administration has set up a new office of climate change and health. So that is up and running as of last week.
Thank you. So Emily, while you're here, I think I might have a question for you. Will diseases with extremely high national disability and economic burden, but no diagnosis or treatments like ME and long COVID, be included in the plan?
Yeah, so that's actually an excellent question. Essentially, it relates also to what Nico had mentioned. Once we have data, before we have data for those important items, we can include them as developmental or research objectives. And we do reflect in the slate of objectives items that have significant national importance, disease burden, and economic burden. So those can be considered. It just really is a matter of their being proposed I would encourage individuals to participate in the public comment period that we have annually on the objectives, and you can recommend items that would be considered for inclusion.
And David, I think I have a question for you. What if I need more information about target setting?
Yeah, so I didn't have a whole lot of time to cover target setting. We do have documentation on the website. There's also a statistical publication called a statistical note that was referenced on my one of my slides. You can look up statistical note 28 published by NCHS that goes into great detail about the methods and kind of the underpinnings of target setting. In addition to all of those the tools that I mentioned and the documentation, the Healthy People team is also working on a series of webinars and tutorials to provide even more guidance. So there's some information and materials that are available now, and then certainly more to come in the future.
All right. Here's a question for anybody. How can we best connect the Healthy People 2030 goals and their recommendations in the National Academy's report on implementing high quality primary care?
I can jump in and start. So we do have an entire topic area in Healthy People 2030 dedicated to access to healthcare services. So I think that mapping a number of the Healthy People access objectives and the data and the benchmarks can help to support the National Academy's report.
I think another place where this may be achieved or at least pursued is to make sure that when primary care and health systems in general are pursuing determinants of health in their communities, which is a major emerging focus, that there is a connection made to the goals and objectives that reflect the needs of those communities in the context of Healthy People 2030. So setting goals that are broader than the health system itself, but recognizing that those linkages can be made to an initiative such as Healthy People 2030 can be really useful. So that's another opportunity, I think, to work from the care system out rather than from the healthy people perspective out.
So I actually think that might be all the time we have, because I know that Dr. Ko wants to say a few words. I want to thank all our panelists for joining us today. And on behalf of the Office for Alumni Affairs at the Harvard Chan School, thank you for taking the time to be with us, for you in the audience on today's program for Healthy People 2030. We will be sharing a survey in the Q&A box for you to provide feedback from today's session and to help us plan future programming. But I do want to hand it back to Howard, who has a few closing thoughts. Howard?
Well, David, thank you so much. And I think we did not disappoint. This was another fascinating Healthy People overview. So thank you, everybody, for tuning in and watching. I particularly want to thank Emmeline first for her overview of the history, the progress. Nobody knows this area more than Emmeline. God bless her. She's been at this for a long, long time, and she's so dedicated. I want to thank David for the updates on the statistical and analytic rigor. I mean, the target setting methods and the trend projections and the added focus on disparities, I think is hugely important. How you can use the website to tailor your own searches and find your own information, I think is all so great in terms of being user friendly. For the equity theme, let me just point out, by the way, that the August 17th issue of JAMA just a couple of weeks ago is totally dedicated to racial ethnic health disparities. And I had the honor of co-writing a piece on disparities related to Asian Americans, Native Hawaiians, and Pacific Islanders. So that conversation will continue going forward. But I really want to also thank Nico for spending so much time talking about an assets-based approach and talking about well-being as well as health, because I think that's where the national conversation is going in the future. That's what I'm trying to do in my work at the school with my colleagues in the Flourishing program led by Dr. Vanderweel. And when people wake up in the morning, what do they think about? They think about life satisfaction. They think about their social relationships. They think about whether they have meaning and purpose in their lives, in addition to whether they are physically healthy or not. So I think those themes, particularly in the time of COVID, will get much more attention going forward. And of course, Healthy People is right on top of that, as always. My final comment is in that theme, if you look at the buildings at our school, the Harvard Chan School of Public Health, everybody who's a student knows that engraved in 7 languages in the concrete of the exterior of our school is the WHO phrase, the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being. I think by our dedication to healthy people through the decades and by working together and having conversations like this, we can move toward that goal for everyone, even at a very difficult time like this. So thank you so much, David and everyone for joining, and look forward to seeing you all again when we do this one more time, at least.